supplements, everyone's favorite topic, which we always talk about. There's a few things, prerequisite talking about supplements. And first, if money's an issue, I would always probably recommend people spend that money on better quality food, grass-fed stuff, more vegetables, more fruits and vegetables, because that way you're probably going to hit your micronutrients anyway without taking a supplement. Not to say that supplements should never be taken. I always prerequisite talking about supplements in saying that most people need a blood test to be able to see what you're deficient in, to be able to supplement then. And then you can go back and get the bloods a few months later, make sure you're absorbing it and make sure your levels are back to normal. So if you have blood tests, you can send them to me and I can get them interpreted and then specifically tell you what supplements you need. But here's some examples of stuff you can probably just take the majority of the time. Obviously, always recommend doctor supervision as well. Okay. Now, if you're struggling with your protein intake, okay, you find it very, very hard to eat that. It's no harm taking whey protein shakes. If you need to hit that protein intake to make sure we're maintaining that muscle mass. Some people just don't do whey protein well. They may be dairy intolerant or have an intolerance, slight intolerance. You can use BCAAs, which is a drink. Okay. We can also use either BCAAs or any vegan protein for vegans, vegetarians, etc. as a way of getting that protein intake up, and especially BCAAs for vegans and vegetarians, because they contain very important branched chain amino acids that we need to repair muscle and make sure we're not sacrificing any muscle. So again, I will give you specific indications, but if you're just looking at it from your own point of view, we can do either three. Next is vitamin D. If you're in a cold climate, if you're in Europe at the moment where the weather's getting cold, you're not getting enough sun. If you don't get at least 20 minutes of sun, with 70% of your body open to that sunshine to absorb it per week, you may be deficient in that, especially people working in offices every day where you're not getting that peak kind of UVA, UVB around 1 to 2 p.m. It's probably most likely you'll be some kind of vitamin D deficiency. So we can, again, with the doctor supervision, supplement about 5,000 IU a day is pretty safe for most people, okay? If you're deficient, however, you would maybe mega dose that, but that's when you would see what your bloods are at and you can look at them again. Magnesium, again, it plays multiple roles in the body. You probably know it more for being able to relax the nervous system and help us sleep at night. One of the roles, which is why I'll probably take it before bed. A safe dose is around 500 milligrams per day. Zinc, involved in the immune system, involved make sure it's testosterone. Again, it has about 500-600 jobs in the body, cell regulation, making sure our cells are healthy at a cellular level. And again, you will need to get that tested to see the dosage. To maintain a normal dose, could be 5 to 10 milligrams per day, but for someone who's deficient, it could be a few hundred milligrams for a short period of time. Okay, and then the last one is iron supplementation, specifically for those that don't eat meat, and even more so for women in general who don't eat a lot of meat. You could be borderline anemic. We see that a lot, that impacts your energy. So it's either getting iron supplementation or a multivitamin with iron, but you will need bloods to be able to see the dosage from that as well.